it's a great relief because you know that you were there when they started their care, and now not only do you get to see where they used to be, but now you get to see where they're at, and it makes you feel great. I did 4.5 years in the Marine Corps, and I had some combat time. I wasn't allowed to re-enlist due to a back injury that I got. I liked helping people, so I decided to get into the medical field. I went to school at Everest, and I did my extern or my internship training here with Deuk Spine, and I got hired on after that, and I've been here ever since. It was kind of funny during my externship. I came in all scared. I didn't know what to expect. I was told this was like the most fast-paced clinic. And it is fast-paced clinic between the 4 doctors. You know, you're dealing with so many different patients being one of the medical assistants. But I kind of like got taken under the wing by a couple of them. And they, well, I don't really know how to put it into words for you. But it was kind of like they became like that older brother-sister kind of thing. And once that older brother-sister wore off, you kind of knew what you were doing. They let you out on your own, you know, here you go. And if you had any questions, they were there. Now they're kind of like that equal. You're more like a cousin relationship. Like the brother-sister, but in an equal sense as a cousin. So, and it is like a family here.
Hey, how are you? Good, good. Okay.
NMA is the first line of defense charged with the patient's care. We see the patient, we examine them, we ask them questions, we perform exams, we find out where their pain is, the neck, the back, do you have pains into the arms, legs, numbness, tingling, or even headaches? What medications are you allergic to? Are you on any blood thinners? That's a big thing here because if you're doing surgery, you don't want something that's going to bleed a lot, especially if you're doing a procedure for like shots or injections. Once we leave the room, Dr. Deuk has already been looking at the films, already been discussing the films with Roger, the PA. We present to either Roger or Dr. Deuk. Mostly it's Dr. Deuk. And Dr. Deuk wants to know, new patient, returning patient, what's the problem, anything improved, what did we do last time, what testing did we order, or what testing do we need to order. So when Dr. Deuk goes into the room, he's not going into a room and basically doing the same thing we've already did. He's going in with a good understanding and just get right into the treatment or the care for the patient. After we're done with the patient at that point, we're in charge of scheduling all their future appointments, testing. Do we need to send them out to another doctor? Did we find something on an MRI and that they need to be seen for? And that's another thing that we're in charge of there is scheduling and making sure the patients are getting their testing done before they come back to see Dr. Deuk. I mainly follow Dr. Deuk, but I also work in between Dr. Greenwald, the other neurosurgeon, Dr. Patel, our pain management doctor, and I sometimes do help out in Dr. Hillis's clinic, our neurologist. The one benefit that I found out of actually having this combined into the Deuk Spine Institute is that the patients, the records are right there. If Dr. Deuk refers over to Dr. Patel, we know why. We don't have to call and have the orders faxed over or the last visit records faxed over to us because we're waiting on those. They're right there on the chart, they're ready to go. The doctor can refer to those at any time. Same thing if Dr. Patel sends them back to Dr. Deuk because he's tried shots, it's failed, it's time for surgery, then Dr. Deuk can look back, see what shots have been done, and say, okay, well now it's time to either do surgery or do another test and see what's going on. I do see a lot with the laser surgery patients that they'll actually go into surgery and they'll come out and right after surgery they're already feeling the relief from the laser surgery. They're already feeling the exact what Dr. Deuk told them to expect and they're very happy. You have patients that go back to work the very next day. They're up running around ready to go. You see them 2 weeks later just to follow up with them and they're still doing great and they're ready. They just want to be released full duty back to work. So the laser surgery is really great. Anyone that's contemplating back surgery or even being seen for their back or their neck problems, if you want to call the Deuk Spine Institute, I'd recommend it highly. I mean, I'm not saying that just because I work here. I'm also a VA patient, a veteran. And Dr. Deuk is also my doctor. Not only am I working for him, but now I'm his patient, thanks to the VA. And if there's anyone I trust to do my surgery, it's him. I've seen the results. I know how well the results are, what the outcome is. And anybody that's contemplating it, don't be scared. Call up, even just, just to come in and talk about it. There's no reason to actually live with back pain all your life. I just wish there was some other way to tell them, I don't want to tell them, you got to be beat over the head to do it. It's your choice. I know that, people are scared. Surgery does scare a lot of people. But when you see the results firsthand, you're actually more at ease with it. That's why if anyone does mine, it's going to be Dr. Deuk.